Hey everyone, Aaron Moore here with You Got a Guy Business Spotlight. Today we're sitting with Dr. Andrew Hicks at Highlands Family Chiropractic, where I am actually a client. Good morning.
Good morning.
Thanks for letting me come hang out.
Appreciate you coming by.
And not tweaking me today. He's taking it easy on me today. As you know, I do spotlights on people that I do business with that I want to highlight and let people know about. And Dr. Hicks is one of those people. So give us a little background about you. I know you've been doing chiropractic work now for roughly 20 years, right?
Roughly just shy of 20 years. It's my second career.
Yeah?
My first career, I did pathology, where I would actually do things like autopsies.
Oh my God.
Yeah.
That helps you understand the body.
I've been good knowledge of anatomy for 25 years.
Uh-huh.
But I went from pathology to chiropractic because everything just kind of cycled into the next prescription and or problem.
Mm-hmm.
I thought there's got to be a different way. So that led me to chiropractic, or it led me to look at other things, which then led me to chiropractic, which actually was fueled because my mother was a migraine sufferer.
Oh, that's terrible.
It was tough at times, a couple of weeks even.
Mm-hmm.
We're talking about lights off, nausea, vomiting.
I don't wish that on anyone.
So chiropractic is extremely effective on migraines, extremely effective on headaches.
I didn't know that. So you learned something
every day. But yeah, migraines. And that then is, with not getting into the weeds, that led me to chiropractic. My first clinic in Arizona was a multidisciplinary clinic. We had MDs, PTs, chiropractors, massage therapists. We did stem cell injections, all kinds of different things. Yeah, we wanted to fix, and in today's world, you don't see that a lot. Healthcare in today's world is manage the condition as opposed to fix the condition.
Mm-hmm.
And then we moved from Arizona to Colorado 10 years ago, and I've been here ever since. We do a lot of structural correction, and scoliosis can actually be reduced. People talk a lot about it's a management or wait and see, but it can actually be reduced.
I didn't know that either.
Yep, it's something that it's a unique answer, and we do lots of different things to tell a person whether we can or can't. So I don't want to say it categorically all,
right?
But absolutely you can.
Mm-hmm.
So that's a fun one, especially when you see parents talking to orthopedic surgeons about getting surgery on a 12 or 13 or 14-year-old child.
Wow.
And we're able to actually work against that.
So without having to go to surgery.
Without having to go to surgery.
I mean, that's ideal.
The problem is not enough people know that.
Mm-hmm.
And unfortunately, there's chiropractic that will actually correct that and chiropractic that will manage that. And it's important that a person has that conversation with the practitioner, because managing it is fine, but the expectation of that correcting it is not okay. And that just needs to be clearly articulated. And
got it.
Chiropractic, the basic education doesn't teach a chiropractor how to manage scoliosis or correct scoliosis.
Right.
I have essentially a second fellowship in biomechanics that tells me how that's where you learn those things.
That's pretty cool. I mean, one of the things that in my experience working with you is that I like is I know that you know what you're talking about, right? I know that you understand how the body works. I know, and he's got an x-ray machine. He goes over, he'll do that with you and review. We're all messed up, and how to correct that and whatever. I've been using him for, what is wrong with me?
We're doing shockwave on your shoulder.
Yeah, it's shockwave, but I've had this crazy, I can't sometimes even comb my hair from,
it's like a tendonitis.
Old. Tendonitis. I'm an old guy. And he basically uses this electric shockwave therapy on my shoulder the last 6 weeks, and I've got way better range of motion. But more importantly, I've known what to expect every time I walk in. He explains it and make sure that's the right thing for me. There are other avenues we could have gone down, and this is proven to be effective. So that's what I like about the way that you conduct your business here.
Well, I appreciate that. We're very research based. I myself have research out there with my name on it. So
do you really?
Only one, but it's out there.
And it's more than I have.
It's one leads to two, leads to others, but it's a part that I'm working on growing too, because what we do is very research based, and all I have to do is gather the data and write them.
Hmm.
Just take it because we're already doing what the publications require.
Yeah. Well, what should people know about? I mean, if they're struggling, there's so many things that you can help with, so it's kind of hard to say, hey, specifically this. But I would say if you're in pain on a regular basis, that you're trying to figure out, you're taking a lot of ibuprofen.
Mm-hmm.
I have not taken ibuprofen since we started. I haven't taken an ibuprofen in 6 weeks since we started.
Fantastic.
Because he told me I couldn't because it would interfere with the healing process. But I was taking two every 4 hours, dealing with this pain, and I'm not taking any anymore. And I forgot to tell you that. And that to me is obviously working. I don't have to take pain medication. So if you're hobbling around and just dealing and just putting it off, you should come see him because he's going to at least give you some direction. You might not be a good fit for each other, but I promise you he will know how to do it, and you got to give him a chance to kind of explain it. What are some, there's a lot of, I took some video footage of all these things out here. He's got quite a few medieval looking things going on out there. So tell me a little bit about other things that you do out here.
So those are the human body is a three-dimensional object, right? So we have to look at the way the spine moves relative to what's happening. So somebody who has a kink to the right because it hurts to bend left, well, one of the things that doesn't get portrayed very well is the spine will bend and rotate simultaneously. It does two motions at the same time. The reason that that's an important concept is because in order to fix it, you have to uncouple it in the same direction. Our traction equipment allows us to approach the body three-dimensionally. It allows us to take those unique rotations and translations and place the person in that position that then essentially mirror images it, reverses it.
Interesting.
So if it bends and rotates, we then rotate and bend, and it straightens out the spine, and then that's what gets rid of pain. Pain occurs typically because there's a mismatch between structurally what the body is supposed to have and what the body actually has. I liken it to like a contractor. A contractor shows up with blueprints and they want to build a bank. And then if the architect and the construction crew builds a McDonald's, you have a problem.
Yeah.
So you actually, the human body has a blueprint and it's measurable. It's used by surgeons and they then fix these same problems, but with surgery.
Okay.
So they measure it. They see the pelvic incidence. It measures blank. Oh, you need to have this. Let's fuse it with blank degrees of fusions. We do the same thing, but we then fix it without surgery.
Mm. And that's great. I mean, I've had surgery, and I'd much rather not have surgery. It takes a long time to heal, and it's just so disruptive in so many ways. So it's good to give a chiropractor, it's good to give Dr. Hicks an opportunity to at least right the wrongs before you have to go down that road, which is I didn't want to get surgery, and that was the direction I was going. And I'm seeing great gains. What else should we know about Highlands Family Chiropractic and Dr. Hicks?
Well, we have two chiropractors here. There's myself and Dr. Charlotte.
Who I've met. She's awesome.
Dr. Charlotte she has been with me almost 10 years.
Wow.
In some capacity. She actually started as my receptionist. I hired her kind of right out of college, relatively speaking. And she liked it so much, she then went to school to become a chiropractor, and we rehired her after she graduated.
That's very cool.
So she's been somewhere around 2016, minus school, she's been with me for the most part ever since.
That's awesome.
So it's been very cool. And she does pediatrics. She does pregnant women, Webster technique. It's a International Chiropractic Pediatric Association certification to help pregnant women through their pregnancy to maximize their ability to deliver. So that's something that we don't get talking about enough. But we do dry needling. We see sports athletes. We do taping for those, the volleyball player who's got shoulder aches. Graston technique is a type of muscle scraping technique that it's actually very old. It's in Chinese, it's guasha or guasha. I never can pronounce that right. But it's where you break up fascial adhesions in the muscle and allow increased range of motion. We have massage therapy on site, so dry needling, shockwave, massage therapy on site, and digital x-rays in today's world. The beautiful thing about that is the exposure level is so low with that nowadays, that it's more important, make sure you see air and get your radon mitigation under control. In
Yeah.
all seriousness, that's actually your background exposure is a greater risk than what x-ray is in today's world.
Yeah, we do radon tests on all the houses we deal with,
Yes.
just
And
about.
it literally is, it's a form of radiation, and it's more important that that's under control even than x-ray.
Hmm.
So that's just the technology advancements, if you will.
So what I like about this, obviously not affiliated with a big conglomerate chain. This is his deal. He's worked really hard to put it together. He's got a big client base for a reason. They're always busy when I come in, and I don't hear any crying or screaming. They do it right.
You occasionally get the little baby in, they'll cry.
Yeah, no, and I almost cried, but it was not really, but it was, I'm a believer, and I know chiropractic medicine, there's a lot of skepticism from some people, and it's just, I think, because you don't understand it. And I started using a chiropractor after a car accident when I totaled my first car 6 months after I got my license, and
Yeah.
and they had to put me back together.
Mm-hmm.
And it's important, and I think it's a wonderful service you provide. He's right here in Highlands Ranch, in the heart of it, real close to Valor and basically University and Highlands Ranch Parkway. You should come check him out.
There is. I did forget one thing. There's one more service
Yeah.
we offer that I don't know why it escaped me, but we have second. We have nutrition. We
Oh
do,
yeah.
yes,
Yeah.
we do nutritional consults. We do everything from weight loss to weight gain.
Mm-hmm. I
So
did see that.
when patients come into us, it's about nutrition, not about weight loss. Yes, that's a common feature. Patients like weight loss, but when you heal the body from the inside out, you get dramatically better results. So many of our patients are doing nutrition while we work on something else, and those outcomes go up as well because you're
And
filling your
and the
body.
weight loss is almost a byproduct of eating better, right? You're not focused on the weight loss. And on a total side note, I'm going through John Foster's Hero 5 program, and I've lost, I'm going to say, 15 pounds,
Mm-hmm.
a little over 15 pounds now. It fluctuates, but it's a byproduct of the nutrition,
Mm-hmm.
the weight training, the cardio, all the things, and it's massive. So there's a lot of quick fix weight loss things out there that just, go watch the Biggest Loser documentary, right?
Oh my
And
gosh.
it's a terrible story about doing it that way, and the guy put all the weight and then some and then a lot more back
Back
on.
on.
This will give you the tools to be able to do it effectively and long term. Especially as we're getting older. This may not, nobody in their 20s is going to listen to this, right? Unless they are athletes. But I'm 51 now, and it matters.
Mm-hmm.
And it's impactful. So yeah, I did, and I'm glad you brought that up because I meant to talk about that. So yeah, give him a chance. I'll put his information on there so you could take a look and give him a call and have a consult. But if nothing else, talk to him about what you have going on. I promise you he's got a solution for you, one fashion or another. But thank you very much for taking the time,
Appreciate you.
bringing me into your office and fixing my arm.
You bet.
Cool.
Thank you so much.